It's about the top of the hour here. So I just wanted to go ahead and kick off. It's such a pleasure to see so many people join us this afternoon for this discussion. My name is Carrie Hobson-Pape, and I am honored to serve as the Executive Director of the Alliance. It is very clear our work is dependent on our people, and I am constantly amazed by the remarkable commitment of the professionals in donation and transplantation. With that said, it has certainly been a difficult year for 18 months, and we have heard across the community of practice that the current labor challenges are placing an extreme burden on our organizations. So given that, we are proud to partner with Unis to bring this collaborative program to you today. We have an incredible group of diverse panelists from donation and transplantation joining us with our moderator, Tony Bridwell. After today's session, the Alliance will continue to be here to support you and your teams with onboarding and ongoing learning. Today's session is designed to be very interactive in nature, with active responses and breakout sessions. So thank you for joining and for participating. Deanna Fenton will be sharing our requested rules of engagement shortly. But in the meantime, please keep yourself on mute. And with that, I would like to pass this now to our friend and colleague at Unis, Mel Farley. Mel?
Thanks so much, Carrie. It's great to have everyone here, and I echo everything Carrie has said. We are excited to be partnering with the Alliance on this very important topic for our community. I'm excited that Carrie reached out to see if we would be interested in. I forgot to announce who I am. I am Mel Farley. I am with Unis. I am the manager of organizational development and learning. And so this hopefully is the first of many other partnerships that we can participate in to present to you some great information that is information that you all have been requesting. We're going to kick off with Sarah Toronto, who is the Unis Transplant Analytics and Service Line Leader. She's been here with Unis for 25 years, and she'll be talking about the Unis Staffing Survey.
Great, thank you, Mel. And I want to thank you all for the opportunity to share with you a very brief overview of the existing Unis staffing survey that's available to Unis transplant hospitals, along with some of the really exciting changes that are coming with that project. Next slide, please. So hopefully many of you are aware of the Unis staffing survey application. This tool has been available to all transplant hospitals for many years. Early each calendar year, the application opens up to collect staffing information for each transplant program from the prior year. Separate data are collected by organ and then also adult versus pediatric programs as applicable. Hopefully you can see in the middle image on this slide, it's just a little screenshot of some of the types of data that are collected in the existing application. But it includes things like the number of FTEs that are devoted to positions such as pre and post-transplant coordinators, data coordinators, transplant surgeons, things like that. Additionally, the report collects some demographic information about the program. This includes items like the number of referrals and then post-transplant clinic visits, along with the type of institution, so academic or non-academic, etc. After collecting these data later in the year, the results, also comparison information, are made available, but only to those programs that have participated and submitted data to the survey. These results are currently provided in a table in the application, and you can see that in an image to the left. They include items like the ratio of the number of post-transplant coordinators to the number of transplants performed. The results are provided for the individual program itself, along with benchmarking to national and regional results, along with a comparison to other programs of a similar size. More recently, we have also added a supplemental chapter of these results. You can see that in the graphic on the right, and those are included in the Unis benchmark report. While the standard benchmark report is available to all hospitals, again, the staffing survey information is currently only provided to those programs that participated in that survey. So you can see how these types of results could be really useful in understanding if your program is understaffed relative to other similarly sized programs, and then being able to take that information to share with hospital administration as evidence of need when you're requesting additional resources. Historically, a large percentage of transplant programs have participated in the staffing survey, and we've consistently heard from the community that there is great value in the tool, as it is the only one of its kind really focused on transplantation. That said, while we have made some changes to the tool over the years in response to feedback, it was definitely time for a major update to this application and tool. So we need to update definitions, review the currency of positions, and then of course we can definitely do something better with the reporting back the results. I see a question pop up. The Unis survey is actually just for transplant hospitals currently, but we could certainly discuss if there was desire by the OPO community to have a similar tool. That would definitely be something we could talk about. Next slide, please. So based on all of that feedback, we've embarked on a collaborative effort with the transplant community to update both the data collection tool along with the delivery of the results. So we reached out for volunteers, and we have been just incredibly overwhelmed with the support and response. So we've formed a staffing survey user group that includes more than 60 individuals from across the country, and I think many of you are on the call right now. We started out by soliciting ideas from this group. This included both what they love about the current report, but also what their challenges and pain points have been, what's missing, and then obviously ideas for an update to the reporting piece of this tool. So the group then met to discuss these ideas and brainstorm some more. The ideas were collated into a spreadsheet shared with the user group for their feedback on each of the suggested items. We received that feedback, and we're now in the process of using those responses to put together a draft tool to share with the user group later this month. We plan to have the new data collection tool ready for the 2021 data collection early in 2022. So each year we look at the prior year. Once we finalize the requirements for the data collection tool, then we're going to move on to the display of the results. These will be provided in a Tableau dashboard that will be available in the data services portal. It will allow for much more customization of the output rather than the static categories and benchmarking groups. And then what we also want to do is we collect data over time in the new tool, also allow you to kind of see your changes over time as well as nationally. So next slide, please. We are excited to complete this project, but there's still a lot of work to do. So if you have questions about the project or ideas, please don't hesitate to reach out to me directly. We'd love to hear from you. And with that, I'd like to hand it back to Deanna.
Thank you, Sarah. Good afternoon, everyone. And once again, welcome to today's vital discussion on the current staffing challenges in donation and transplantation. Now, as Carrie and Mel both shared, today we'll be discussing the ongoing challenges of hiring and retaining staff in the current climate and offering strategies that our panel of leaders have implemented within their own organizations to address some of these challenges. Specifically, we'll highlight new staffing models explored, effective onboarding strategies, potential training opportunities for OPOs, hospitals, and transplant centers, as well as approaches to improving employee retention and reducing staff burnout. Now, before I introduce our moderator and turn the floor over to our panelists, I'd like to take this opportunity to review just a few general housekeeping items. Now, to ensure that this is a successful and engaging experience, I'd like to ask that you take note of the following recommended rules of engagement. As you can see, this is not our typical webinar platform, so to ensure that you have the best view of today's discussion, we recommend adjusting your view so that you can see the active speaker window only. To do so, please navigate to the upper right-hand corner of your screen and set your view options to speaker view. Now, upon joining us for today's discussion, and as Carrie mentioned, you may have noticed that your audio lines have been muted. This is to help us ensure that we have the best audio quality for our presenters. Please remember to keep yourself muted at all times unless you're actively speaking during our open discussion periods. Now, throughout the course of today's discussion, we'll be weaving in a series of breakout rooms and discussion opportunities that will allow you a great chance to engage with one another, to share your own experiences, challenges, and identified solutions. Now, having said that, please be sure to turn on your camera. We'll want to see you during those discussions. Now, of course, you're welcome to turn them off during the program itself, but once we transition to those open discussion periods, we'd appreciate it if you turn on your cameras to fully engage with our presenters and your colleagues. Now, another thing that will be very helpful for our moderator of today's discussion is updating your name in Zoom so that we can recognize you. So to do that, you'll go ahead and open up the Participants tab, click beside your name, and under More, you'll see an option to rename. We recommend typing your full name and possibly your organization, as you can see here in this example. Now, lastly, this is meant to be an interactive, engaging learning opportunity, so please be sure to take advantage of the chat feature. If you have any questions for our presenters, please feel free to submit them at any time using that chat box. Likewise, should you want to add any comments or thoughts or anything to the conversation, you're welcome to submit your comments at any time. Now, for those of you who submitted questions during the registration process, please know that we've done our best to compile your questions and we'll have our presenters address them throughout the course of today's discussion. Now, additionally, during our time together, we'll be utilizing the Mentimeter tool to provide you with an opportunity to actively participate in the discussion and share your valuable insights. To submit any comments that you may have, please navigate to menti.com, and when prompted, you'll enter the following code, 74011250. We'll go ahead and also add that in the chat for you so that you have that as a point of reference. Now, should you have any difficulties accessing this tool, please feel free to contact us directly through the Zoom chat. Now, for those of you that may be interested in continuing education credits, please note that we are offering 1.5 SEPSI credits for your participation in today's discussion. Following the conclusion of today's program, you will receive an email from us with detailed instructions on how to claim your credits. Now, having said that, even if you're not interested in CEs, we highly recommend obtaining a certificate of attendance so that you can complete the post-event evaluation and provide us with your valuable feedback. We certainly want to hear from you and your thoughts for today's discussion and would appreciate your input on any future programs or topics that you'd like us to consider. Now, as an added note, today's discussion will be recorded and made on demand for your convenience. Having said that, please note that the discussions that take place in your respective breakout rooms will not be recorded. Details on how to access the recording itself will be shared via email following the conclusion of today's program. Now, at this point in time, I'd like to begin today's program by giving a warm welcome to our moderator, Tony Bridwell, Chief Talent Officer at Ryan LLC. Now, Tony leads global human resources with a focus on enhancing, communicating, and driving Ryan's award-winning culture to support the firm's strategic vision while gaining greater competitive advantage by attracting, developing, and retaining the most talented tax professionals and associates in the industry. He is a highly recognized thought leader in corporate culture, learning and development, and human resources, with more than 25 years of global leadership expertise, inspiring, motivating, and empowering employees to realize their highest potential. He is an accomplished author, speaker, and consultant in the work of purpose and culture, and brings hands-on experience as a practitioner of maximizing high-functioning cultures. Joining Tony today is our panel of knowledgeable leaders within the community. So over the course of discussion, you'll get an opportunity to hear from Diane Brockmeyer, President and CEO of Mid-America Transplant, Rebecca McKay, Director of Human Resources at LifeGift, Ian Jameson, Vice President of Transplant Services at Duke Health, Paul Myung, Senior Administrative Director of Massachusetts General, and last but not least, Samantha Reed, System Administrator at Springfield Memorial Hospital. Now, on behalf of the entire Alliance team and the Unis team, I'd like to thank you all for joining us today. And with that, Tony, I'll go ahead and turn the floor over to you.
Deanna, that was a lot. Man, you did such a fabulous job doing all of that. Thank you so, so much. And what an honor and privilege it is for me to be here and be part of this for multiple reasons. One, I have a very vested interest in the outcome as a living donor. Matter of fact, I was sharing with the panel right before we started this. In 6 days, I will celebrate our 10th anniversary of our kidney swap, which is very, very exciting. And we have a big celebration planned for that. So this conversation takes on a very, very personal meaning for me also. Before we go any further, here's what I know everybody is sitting there wondering, and there's a couple hundred people on right now. Dang it, what was that Mentimeter code? It went by so fast, I didn't write it down. So I'm going to give everybody get their pencil, their paper, their pen, the chisel. There it is right there. Deanna is like amazing on these. Write this code down, 74011250. I have already got mine pulled up. This is amazing technology. You're going to want to participate and play along as we go throughout our time together. So here's what's going to happen. This is a little bit different format than most people are used to when it comes to panels and even virtual panels. Because look, we're going to talk about the big issues, labor, big issue. If everybody had their camera on right now, and I asked you to raise your hand if you're dealing with talent or labor issues of some kind, based on statistics, everyone's hand will go up. So we're going to deal with the big issues. Now, in the big issue of labor and talent, there's a couple of buckets that we're going to unpack a little bit today based off the, hundreds of questions that came in. Deanna and the team did a phenomenal job of bucketing those into big themes. And there's a couple of big themes that came out of this. And we're gonna do our best to get through these big themes. We're going to talk about dealing with talent, dealing with labor shortages, et cetera, but also we're going to pull the thread on some of these, and we're going to talk about what are the compensation tends to be where we normally go. But if you really think about it, you're talking in the category of total rewards. Compensation is a component of that, but we're going to talk about this bigger idea of total rewards, which compensation is clearly a part of that. We're also going to talk about some well-being. Hey, look, we're in the well-being business. And so we're going to talk about some well-being. Specifically, we're really going to pull the thread and talk about burnout. Now, it's a big topic right now. We're going to have a little bit of a conversation about that. We're going to hear from our panel, and we're going to share some more about that. And then ultimately, there's this idea of planning and technology and what is it that we need to be thinking about and doing going forward. Now, here's where I'm going to set the tone. It's a little different because I've sat on many panels and I have attended many panels. And frequently what happens is people log on and they're looking for the silver bullet. They're looking for the one item that if the panelists will just tell me what to do, I'm just going to do exactly what Sam says. And if Ian has got the answer, and I'm going to run out and go do that. Now, here's where I'm going to put everybody on a little bit of a different curve on this particular conversation, because you need to be looking through a couple of lenses here, and one of them is a cultural lens. And this is a really, really important part of this conversation working well, because look, Becky's going to tell you what's going on down Life Gift, and it's going to be phenomenal, but ultimately her culture is set up for that to work. And we're going to unpack this so everybody understands it. So I need everybody on this to be listening for a couple of different items. One, tactically, what's going on and what's working. But two, what in the culture allowed that to work? Because I'm going to tell everybody right now, this is a little bit of my wheelhouse, is where we spend a lot of time in our organization. Is you can have the best strategy, but if your culture's not aligned to deal with that strategy, well, look, Peter Drucker said it back in the 70s, culture will eat strategy every single day. So you're going to hear some wonderful ideas, but I need you to also listen to these ideas through the lens of, will my culture allow that to happen? And if not, then you need to have a conversation before you have the other conversation. And that is, what might need to shift in my culture in order for this really wonderful idea that Diane's going to talk to us about is going to work. And so that's the listening, the active listening that I'm going to need everybody to have as we navigate our way through this core conversation. So if everybody had their camera on, I'd say nod if you understand. This means you don't understand. But since I only see the panel right now, I'm just going to take it that everybody understands. All right, so here's what's going to happen right off the bat. We're going to stretch our legs technology-wise so we don't pull a hammy, and we're going to jump right into Mentimeter. So I can't see everybody, but my panel, if everybody on the panel would just grab their technology, because I know if your camera's off right now, I know what you're doing, right? I know you're checking your email. I know you're looking at your phone. I get it. Everybody go to Mentimeter, and we've put the first question in Mentimeter, right? So the first question is, what word or phrase describes how your organization, oh, wait a minute. That's the second question. I want the first question. What word or phrase best describes the current labor market? That should be the first question. Is that the first question? See, I'm already ahead of everybody else. I'm already on the second question. The first question is, what word or phrase best describes the current labor market? So you've got a couple of places there, type in your words, and then we're going to get some of you are putting it in the chat. And by the way, Ann, thank you for putting that in the chat, because I think most everybody's going to go, yeah, what Ann said, right? So everybody do that. I'm scrolling down, looking at a couple hundred people that's on here. I see a lot of familiar names, by the way. Thank you for being on here. Many of you probably have seen me or heard me speak at an AOPO or Unos conference in the back as a keynote speaker. And so if you are here and we have been in the same room, it's good to see everybody. All right, so here we have live, real time. This is great stuff. Panel, get ready to feed on this. This is going to be fun. So competitive, of course, challenging right off the bat, and prime the whole group with that word. Tight, limited. Oh, wow. Did everybody see that word? Stressed. The panel, did y'all see that word? Stressed. Limited. Ooh, frustrating. That's a big one. Wow, this one keeps swirling around. Generational. Everybody seeing that one? That one's pretty interesting. Generational. Difficult, exhausted, burned out. Again, the big words right off the bat, though: challenging, competitive, expensive. That's interesting. That's an interesting word. Limited, frustrated. I think everybody's starting to get the hang of this. So one, kudos right off the bat. You're doing a great job of Mentimeter. Two, this is interesting. It's challenging. And I don't think anybody logged on to find out that it's challenging. We're all here because it is challenging. So let's jump in. I'm going to ask some questions of our panel right off the bat. And we're going to ask this in two phrases. You know, one, what your organization's been doing to kind of deal with these challenges, but also as the follow-up, you know, what in your culture has allowed you to do this along the way. So I shared with the panel earlier who was going to go first. I kind of set everybody up here. So I'm just going to give you a heads up. It's Ian, Becky, Diane, Sam, Paul. That's how you're set up on my screen, right, wrong, or indifferent. So Ian, I'm trying to stall and give you enough time to get your thoughts together. So, okay. So Ian, right off the bat, you're seeing what the group is saying. It's challenging. It's expensive. It's frustrating. Look, you guys have been doing some great work up there. Dude, tell me, what have you done? How have you tackled this?
Well, I think interestingly enough, Tony, we faced this before in 2016, 2017, where our terminations, our turnover, jumped to really a high level, sort of 30, 40% amongst our transplant coordinators, our nurse clinician staff. And it was interesting because when we discussed this in a senior leadership team environment, we sort of all turned around and looked at each other and said, well, is there a transplant center out there that isn't experiencing high terminations right now? And nobody could think of one. And ironically, at the next quarterly meeting, we actually did find one, and that was our friends up in Minnesota at Fairview. So kudos to them. At that stage, they were obviously doing a good job, but they were the only one amongst the 260 odd transplant centers that could be identified as not experiencing high turnover. And the most impactful thing that we did, and we've obviously put forward a number of initiatives, particularly over the last 2 years, but since that high turnover rate, was the concept of the float coordinator. This is nothing new. Michigan put this in place a number of years ago, and we certainly learned from that experience. But I think it's important to add this level of depth. And I think the one thing here at Duke that has truly made a difference in staff morale, staff retention, staff resiliency, is the knowledge that we have folks up our sleeve who can be plugged in if there is turnover, if there's FLMA, if there's people just simply being beaten up in terms of calling a recipient in for a transplant the night before, if there happens to be, short-term high level of sickness, as we've experienced in COVID. And what senior leadership took a while for them to understand is we're a large transplant center. I'm here representing the large transplant centers. But when we have, say, 25 transplant coordinators amongst our abdominal programs, that's what we have right now, senior leadership thinks, well, there's a lot of depth amongst 25 transplant coordinators. And I think the biggest thing to impress is it's not 25 transplant coordinators. You have so many sub programs within our abdominal transplant area that just one person, the turnover one person makes a real difference. For our pre-transplant liver program, we have 2 transplant coordinators. For our post-transplant liver program, we have 5 transplant coordinators. For our pre-kidney, we have 5 coordinators. For our living donor program, we have 3 coordinators. So just one person down in any one of those subgroups makes a huge difference. For instance, in our pre-liver, we had one of our coordinators out for extended FLMA. Our number of wait listings dropped 40% during that time that individual was out. And if you don't have somebody who's sort of trained or experienced, who can plug in across all of those sub-programs, then I think you're facing a real challenge. And we've been fortunate enough to have 2 float coordinators for the abdominal side, and they'll plug in any arena, in the pediatric kidney, pediatric liver, living donor arena. They have that experience over time to be able to really help us in the time of need from a staffing perspective. So that's really the one thing that's made a difference for us.
So let me add this, and this is really phenomenal. Let me ask you, because I was jotting down some notes, and you and I have talked before as we've been prepping for this, but I jotted down, it feels a little bit like cross-functional training to a certain degree. It may not be that exactly, but does it have that feel to it?
Very much, and it's interesting because there's a real attraction to being a float coordinator. These individuals are not on call. They're not the ones getting beaten up by recipient call in or patient sick call in the middle of the night when they're on call. So that's one of the attractions of being this role. And so they have that ability to train across all the programs. And all of our coordinators are worth their weight in gold, but the float coordinators are particularly so, because they have that flexibility to plug in as needed. And I tell you one interesting part about the float coordinators, about half of them actually progress to become transplant coordinators when we experience a staffing gap in a particular program. They actually see it as a training ground to become a transplant coordinator. And they make fantastic coordinators when they're up to speed.
Yeah, so it's a developmental program along the way. So we talked about culture, so we're going to look through this lens of culture. Every organization has a culture, whether you like it or not. Every organization has a culture, and culture is the way people think, feel, and act. So help me understand a little bit, and help all of the people on the call understand a little bit. What is it in your culture, specifically from a mindset standpoint, right? So how we think and feel. What is it in your culture that you've put in place or has been in place for a while that allows this to work? Because some people are sitting on the call right now thinking, oh, that'll never work here because blah, 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 blah. But what is it in your culture that has allowed this to work? What, can you put your finger on 1 or 2 items?
Well, the biggest item here at Duke is that we have a well-established CSU culture. And what CSU stands for is Clinical Service Unit. So it's sort of the modern service line, because many healthcare organizations don't like to use business terms such as service lines, so they put clinical in front of it. And Duke has modeled itself along service lines, and you have ambulatory, you have med-surg, you have women and children's, heart, cancer, and of course transplant. So the usual suspects are built around service lines, and you have a dyad leadership with either a physician leader and an administrator, or a triad leadership with a nursing representative, a physician leader and an administrator as well. In transplant, we're simply a dyad leadership. But what that gets us, and the biggest impact for us in terms of culture, is we're considered a growth CSU. You have sort of clinical CSUs and then growth CSUs, and transplant, heart, neurosciences, cancer are considered growth CSUs. What that means is that we meet with our senior leadership quarterly. My physician executive and myself meets with health system leadership biannually, twice a year. And you know, we have the advantage of being a growth CSU, so we can go to them and ask for resources, and you basically have a fast track to make that request versus, you know, the age-old cap in hand type of staffing requests that maybe a clinical CSU battles on a day in and day out basis. But because we're considered growth, and we do grow, I mean, it's no use being a growth CSU if you're retrenching, but because we've experienced growth and experienced growth since the past 10 years or so, you know, we're able to have that fast track to justify and be somewhat innovative around our staffing model.
Love it, love it. Okay, so let's shift just a little bit here. So looking at a big transplant center, Becky, talk to us from an OPO standpoint, and I'll go Becky, Diane, and then I'm going to go to Sam and Paul to get some more transplant center perspective. But Becky, what labor shortage in OPOs? It's a thing, right? What have you been doing there at LifeGift?
Yeah, and I can tell you right now at LifeGift, our turnover rate is 9.9%, which I think is phenomenal. And so we must be doing something right? I have been with LifeGift, it will be 2 years in December. And the thing that I love about LifeGift and what we're doing is our culture. You talked about culture. I love that. You know, culture eats strategy for breakfast. And we're big believers about that. And so if you're good to your team is going to be good to you. And execute whatever those things are that we need to meet. And what has happened at LifeGift is it matters not what the crisis is. Our team steps up and it's 110%. And so we're very collaborative environment. We listen to our frontline staff as well as our leaders. Our leaders are actively involved and step up to support wherever needed. We have excellent hospital partnerships, and we continue to develop those, as well as social platforms. You know, in this virtual environment, it's been a challenge for us, but we've, in an innovative way, even from our frontline staff, have come up with a social platform where they have a place for a break room and things like that. And we're even improving that so that there's more employee engagement with activities. We just had a barbecue event for the first time in person outside. We were socially distanced, but it was wonderful. I mean, to see everyone in person because most of our administrative staff have been working virtually. We also provide mental and emotional support in every way. I mean, this has been very important in our family services areas and clinical areas with difficult cases. We provide critical incident management debriefs where our team can really talk through a difficult case. And we have an amazing LIFT team. And that is the LifeGift Institute for the Future of Transplantation, our organizational and development training, which is led by Scott Briner, director of LIFT. And we have implemented the opportunity for CEUs within our LMS system. So our team doesn't even need to go outside of LifeGift to receive their credentials with a lot of our programs. And that's continuing to grow and improve. And we're growing, we're adding 50 headcount for next year.
Wow.
And so we just hired a new manager of talent acquisition who is phenomenal. So It's been very exciting to be a part of the growth at LifeGift, but we just have an amazing team. So it goes back to culture. You know, again, having that supportive culture, caring about your team. I'll tell you something that our strategic governance council did for our team that I just cannot even thank our organization enough. In the beginning of the pandemic, our organization supplemented everyone's payroll for 3 months with no questions asked. No, they didn't need to take vacation, sick, and this was all before all of the implementation of laws. LifeGift did that for our team. So we care about our team in every way.
So I'm hearing the human side. So there's a transactional side that impacts the talent, but I'm also hearing the human care side. I want to unpack that a little bit more. Diane, I've actually sat across the room from you at that amazing place that you've got up there in St. Louis, and I've seen your culture in play. What have you experienced from a labor and a talent aspect and challenges? What have you done to mitigate that, and what in your culture makes that happen?
Thanks, Tony. Well, you know, if you've been here, we ask our staff if they would use 3 words to describe the culture here, what would they be? And not only do we believe that we take care of our people so that they can take care of others, but they identify this organization as being innovative. And some of those things that you've seen when we've been here, we have a strong emphasis around performance improvement. How do we keep the mission in the forefront of the work that they do every day? And so we've actually put some of those concepts to work, utilizing lean tools to actually apply those to staffing opportunities, which we'd long since done that around looking at performance and outcomes metrics. But we put together a group to look at organ procurement scheduling, and this group came together using lean tools to identify optimal scheduling for the coordinators to try to mitigate turnover. We put a work group together and they've developed a deployment dashboard. So how can you, within the constraints of their tactical work assignments, balance workload? You know, a lot of us work from call schedules. So how can you ensure that, Tony, you're not the person out night after night if I'm sitting home and we're on the same call team? So we've actually used some of our lean tools and our data that we collect. All of us collect a ton of data and actually put it to work on the human element to try to ensure that not only do we support a performance improvement innovative culture, but that the people and their work is acknowledged within that as they try to deliver the mission on a daily basis. It's a tough mission.
Well, so I'm hearing, Diane, what I'm hearing you say, and help me make sure I'm not missing this, but what I'm hearing you say is that there is an extreme intentionality to managing the culture in order to get to the outcomes that you're looking for.
Correct. And I think they go hand in hand. So obviously, as you know, Becky's talked about and Ian have talked about, there are a lot of things that go into combination to create a culture that you work in. But yes, we believe that we have to be very intentional about managing both. Sorry, Tony.
Well, you know the old saying, either you manage the culture or the culture will absolutely manage you. So the intentionality is what I'm hearing there. All right, so I want to shift a little bit. Sam, look, transplant centers come in all sizes and shapes, right? And you're kind of in the sweet spot there. You might not have all the resources that a Duke, I mean, really, who has all the resources of Duke? I mean, come on, right? You may not have all the resources of Duke, but you've been facing these same challenges and you have navigated through this. What have you done? What's made a difference? And then what in your culture has allowed you to accomplish that?
Yeah, so to give everybody just a sense of our size, we are kidney transplant only, and we have 6.5 FTEs dedicated to our transplant program. We do anywhere between, I would say, 20 and 30 transplants a year. We did 34 last year, which was the biggest year we've done since I've been on the program, which is about 7 or 8 years. So the biggest thing in our culture is flexibility and patience among our team. And what I mean by that is we have so many single points of failure in our team, right? We have 2 pre-coordinators, 2 post-coordinators, 1 surgeon, 1 kidney, nephrologist as our medical director. We have a quarter of a pharmacist, a quarter of a dietitian, 1 social worker, half a financial coordinator. So when we have any one of those people that have been out over the past 2 years due to quarantines, children illnesses, the numerous other things that happen in people's lives, it is up to the rest of the team to really step up and help cover those duties. And one of the things I think we've done really well is in that kind of flexibility of our culture is people are willing to try things rapidly. We do a lot of that PDSA, rapid cycle change. And when we fail fast, and we talk about why it didn't work, and we move on to the next opportunity. I think one of the big things that, again, the advantage of having a smaller team, while there's definitely those disadvantages with that single point of failure, is we are able to make those changes quickly. So when I have a coordinator out on leave, we can work with them to have them the ability to work from home. They can still take call, they can still, do charting, they can still make phone calls, where the rest of my organization, when you have these bigger, service lines, these bigger business units, they're not able to make those changes as quickly. There's more red tape that they have to cut through. So kind of in our own little transplant pod, we're able to make those changes really fast. And I'm lucky that my leaders allow us to have that control and just kind of run with it, versus having to kind of go through all these different levels of expertise, all these different levels of approvals to make any kind of change.
Okay, Sam, I got to pull the thread on that, because what you just talked about is everyone else's nirvana, because everybody's leaning in going, dang, Sam, I'm coming to work for you because that is sweet. There, as you get bigger, the fail fast, model becomes a little more cumbersome. So what is it in the culture that allows people to get there? And I know from working in culture, most likely what you're going to say, but I want you to unpack that for everybody just a little bit. What is it from a mindset standpoint that allows that to happen? Because it's critical. Without that, it doesn't work.
It's trust. I mean, that's the biggest word. It's trust. It's trusting your leaders. It's trusting your staff. It's trusting the colleague working next to you, that if you drop the ball on something or you implement a process that's not quite right, no one's going to blame you for it. No one's going to get mad at you for it. You're all going to figure it out together. And that's really hard to do. We have 3 coordinators on our team that have been there for 10 plus years, which I'm very thankful for. But that 4th coordinator, we've turned over quite a bit, because finding someone who is comfortable with that type of approach, but still has the attention to detail and focus to go through all those check boxes we all have to go through for UNOS, for CMS, all those governing bodies. It's a very unique type of person, or a registered nurse in this case. So it's just building that trust and that communication with the rest of the team to understand it's going to be okay, and we're going to figure it out.
Yeah. Okay. So trust is one of those really interesting words. Unfortunately, we can't print up a bunch of shirts and have trust day, and everybody's just going to automatically trust everybody. It'd be really cool if we did. But here, the foundation, what we've discovered from our research, is the foundation for trust begins with psychological safety, right? So there's really 3 elements that has to happen for people to have the mindset to fully engage in a culture. There has to be meaningfulness, there has to be availability, and there has to be safety. And that safety is psychological safety. Dr. Amy Edmondson has done the best work on this. If you're not familiar with the work on psychological safety from Dr. Edmondson, then you need to understand that if you want to lean into what Sam's talking about, from having that fail fast type of cultural aspect, or a shift inside your culture to do that. Paul, I'm going to come to you. Hey, look, Mass General, there's few as dialed in as Mass Gen. I mean, you guys get it, you understand it, but you're not without your challenges, just like everybody else. I mean, you have the same labor market that everybody else is having to deal with. What's been going on up there, and what in the culture has allowed you to do that?
Yeah, thanks, Tony. And I mean, I would preface by saying we may not have the same labor market up here, but we definitely share in the challenges. But I would also agree with Samantha that trust, that's what relationships are built off of. But I would highlight the cultural aspect at MGH that is really seated around effective communication. And what is that? Obviously, if you cannot speak and hear what the other person is saying, then you probably have some other challenges that need to be addressed within this human and service environment. But I would also say that from a cultural perspective, and this is one thing that COVID has actually exposed for us, is around what are those areas that are more cultural norms that we all take for granted, or we place in that these are the cultural expectations category, and what are the cultural goals or aspirations that we all seek to strive towards. And it was very eye-opening, given that we had moved into either a hybrid model. Some folks have gone on to permanent remote roles. But what we realized was when we kept on using the term cultural expectations or job expectations, it removed appreciation, right? We can't just give each other a high five down the hallway or, hey, good job, thanks again, pat on the back, let me give, grab a cup of coffee with you. That went away. So we had to change our kind of cultural norm around expectations and create cultural goals. How do we show up? What do we want to inspire to? How do we build the teams off of what we right now are all on Zoom? And how do we do that? Knowing that we are missing quite a bit of connecting with each other personally, professionally, physically. And so we really had to change and shift how we approach our culture and to do it more deliberately than passively and kind of leaning on what has culturally worked in the past.
Back to that intentionality, Paul, that's very powerful. And look, a lot of people will come into a webinar like this to look for that silver bullet, but I'm hearing this common theme from the panel that while you go to the transactional aspect, in order for those to become sticky and work, there's probably some work culturally that needs to happen behind the scenes in order for that to stick, in order for that to be fully successful. Hey, I want to go back to Mentimeter. Everybody, unless you're having, you're probably having lunch right now or checking your email, but I want you to grab your phone again. I want you to go back to Mentimeter. I'm going to ask everybody else another question here real quick. What word or phrases describes how your organization is reacted to, and we'll just call it the labor crisis or this talent crisis, and so the code is right there if you don't have it, but I want you to type that in real quick because we're gonna kind of springboard off this. So everybody, what word or phrase describes how your organization has reacted to the labor crisis? And I just want to go back to the panel and say thank you very much for sharing what you did, because I heard this common theme. There's been some questions about psychological safety because it is it's a thing, right? And ultimately, you need to understand psychological safety runs on one axis. Motivation and accountability runs on the other axis. And when you look at Dr. Edmondson's work on psychological safety, it's when you have high accountability or high motivation and high psychological safety, you get that upper right-hand quadrant sweet spot that's called the learning zone, the growth zone. And that's really the sweet spot in that upper right, high psychological safety and high motivation. However, and this is what people need to understand, is that when there's low psychological safety, but there's still that high motivation and there's still that high accountability, that equals the anxiety zone, which, by the way, is a gateway to burnout. And we'll unpack burnout here in just a few moments. So what word or phrase best describes how your organization has reacted to the crisis? Okay, I was hoping this was happening, and this is happening. So the reason why we put this in here is because I want people to be encouraged. Look, proactive, flexible, immediate. Okay, so there is some reactiveness in there, thoughtfulness, supportive, adaptability, with empathy. This is huge. And I want everybody to see this, that we're responding well, but yet we're still feeling some of this angst inside organizations, and we're still feeling this burnout. We're still feeling this tension. Just a little bit on burnout. One of our partners that we partner with, and we only have about 3,000 people around the world. So I'm in 8 different countries, and so I deal with this on a global basis. But one of our partners that does research for us on burnout has actually shared some data with us that says that burnout actually happens with our highest engaged individuals. Okay, so when you have a group that's highly engaged, like everybody on this call, when you have a highly engaged organization, and they're dealing with real or perceived unmanageable stress, that's where that burnout starts to kick in. And then we all know the gates. It starts with exhaustion, goes to cynicism, and then ultimately into inefficacy in their work. But you've got to realize that our highest engaged individuals, when they're dealing with real or perceived unmanageable stress, that's where that starts to work. And so burnout really is when people who are highly engaged for a long period of time, without the personal skills or organizational support, this is the definition that Limeade uses, without the personal skills or organizational support to maintain their well-being, they start to lean into that burnout trap. And so ultimately, everything this panel has said up to this point, I need everybody leaning in, developing people, failing quickly, having that psychological safety, putting the human side in, managing the culture. These are all important aspects for each and every one of this. So I love this. Words to describe how we've reacted: thoughtful, immediate, proactive, supportive, flexible. So Band-Aids, we've been putting some Band-Aids on there. Doing more with less, absolutely. So here's what we're going to do. We're going to go into a breakout because I want to unpack a little bit more about the last 20 months. And I want each and every one of you to have an opportunity to spend a little time with some of your peers and some of your partners, and have a deeper conversation, because in this big format, there's a couple hundred of us. We can't all get together and we can't all talk. So we're going to put you in a smaller breakout. In order for this to work, here's what I need you to do. You're going to go into your breakout. I need you to turn on your cameras, and I need you to have a conversation with the people in your breakout. And we're just going to put you in there for 5 minutes. You're going to have a conversation. But here's what I want you to talk about. I want you to talk about any aspect of COVID that has been good for your OPO or transplant center, right? Because normally we have the other conversation, and it's really easy to have the other conversation, but I really want you to be thoughtful about this. What good has come out of the last 20 months for your OPO or your transplant center? And we're going to put you in the breakout groups, and you're going to be mixed up. You may be in there with the transplant center, you may be an OPO. I need you to have this conversation. It's 5 minutes. Get in there, get after it, have this conversation. Then we're going to come back and we'll have a little opportunity to debrief that in some of the chats as we go forward. So, Deanna, we're going to put everybody into hyperspace. We're going to put everybody into their breakout session. Now, when you go into your breakout session, your mic's going to be muted. Come off mute, go back in there, and then you'll see it, and we'll bring you back in. It'll be magical. It'll happen, and it won't hurt anybody much. So, Deanna, if you're ready, set, go. All right, everybody should be coming back in to our big group. Look at all those people with their cameras on. Thank you so much. There are people on the other end, and nobody's chewing their food right now. I see Chad. Hello, Chad. How in the world are you, my friend? Haven't seen you in forever. My goodness. Of course, all my panel went to different parts of the world now, so I can't find my panel, but that's quite all right. It's so good to see all these faces. Thank you for participating. So you'll see on your screen what aspect of COVID was good for the OPO: culture of forgiving, learning new technology, innovation, faster case times. Wow. Increased work from home, virtual meetings allowed everyone to show up on time. I love that. I don't know who put that in there, but yes, 1,000 times over. Better communication and new roles, increased work from home again, forces to be more interactive, schedule flexibility, virtual meetings allow everyone to show up on time. These are all scrolling through. I think what comes out of this is that anytime we are faced with a challenge, and I love this quote, by the way. This quote came from an interview with the leader of the Navy SEALs several years ago. And he said that we train and develop ourselves not to rise to the occasion, but to sink to the level of our training and development. That in any situation, that they always go back to their level of training and development. And so I think what this does is anytime we're faced with this, it allows us to open up and actually see what is capable because we've been training for this, we've been developing for this, and it's allowed us to expand and see what else is possible within ourselves. And we learn so much. And so I want everybody to be encouraged. There's a couple of hundred of us on here. I want you to read this and I want you to be encouraged. There's good that comes from this. Now, here's why this is important culturally. Culture is made up of the way people think, feel, and act. And culture transmits through story, right? Where our brains are hardwired for story, we take experiences of life in through story, and we take stories in 3 ways: when we show up, speak up, and sync up. And so what I need you to understand why this is important is that if the only stories people are hearing are the negative stories, then that starts to create a mindset that everything is broken. But I want you to look at the screen at all of the positive stories of what's coming out. The question you need to be asking yourself is, are we telling these stories inside our organization and inside our culture? Now, some of these are pretty amazing. I want to go to my panel. Anybody on my panel see anything on here that you just totally relate to, that you want to add a little bit more? Sam, Ian, Paul, Diana?
Yeah, I'll jump in. The work from home flexibility has been huge for our program. And I think I'm seeing that a lot up here. I don't know about you guys, but our hospital culture prior to the pandemic was very much, if you're not here, you're not working. And as we have younger, generations coming into the workplace, as we have people that want to balance more work and home life and integrate those a little bit more, we were really behind the curve on that. So one of the good things about COVID has been that is now an acceptable practice. And we've really been able to run with that. And what's been great now is our organization has come forward to actually create rules and structure around that. What type of technology do we give people? What policies do we have in place? When is it acceptable? When is it not? So that's been really good for our hospital. And I think has helped with some of the transitions as we've started to burn out now over the last 18 months that have helped us prevent some of that. Because again, we can allow parents to be home with their children a little bit more. We can allow people to work from home if needed. So that's been a huge win for us.
That's huge. Diana, what about you? Anything on here resonate with you up there in St. Louis? You're on mute. You're on mute. I had to say it. We could not go through an entire webinar without saying it. I should have just got that out at the very first. You're on mute.
So sorry. I think one of the things that resonated with me as I saw it go through is it was something that brought us all together that none of us had ever experienced before. So I think within our teams, we were all certainly approaching it from different perspectives, different demands from staff. Some staff could work remotely, like Samantha just talked about. Obviously in the OPO, the clinical people couldn't work remotely, right? The work was still happening in the hospital, in our building. And so how can you keep that balance? But I think what it really allowed us to do as an organization was keep communication and transparency and the safety of our staff kind of front and center as we work through those elements. And things were changing day by day, what the city allowed us to do, what the CDC was saying. So I think it really created an incredible infrastructure for a great cross-disciplinary team of folks across the organization to be a part of. And many of those enhanced communication tools that we adopted at the time, we've still kept in place because it really was a nice supplement. And kind of at the root of all that was listen to your people.
Yeah, man, I so love that. I so love that. All right, Ian, I'm reading some of these and immediately based on some conversations that we've had prior, I'm thinking of you. I see multiple comments on here. Something good has come out is we've squeezed technology to the point that we're getting juice that we've never gotten before. Does that resonate with you up there at Duke?
No, definitely. I think we're using Epic dashboards day in and day out now, particularly with our transplant staff, our coordinators, our nurse clinicians, our program specialists. In terms of work effort reports, I mean, how hard are our staff working? It's just such a important review, and then to have our staff work with us in terms of the reports. I mean, these reports should come from staff themselves, not sort of a top-down approach. And that's really been eye-opening. And it's been a wonderful collaborative process, particularly when we're in huddles with our staff, where we share information and share work effort that's driven by Epic. We happen to be an Epic site, but these reports can certainly be developed in any EHR. But it's brought us together as a clinical team in terms of sharing work effort. And it helps us justify incremental stuff going forward as well. I mean, this is just not a big brother approach in terms of determining workload. This is a partnership in determining work effort and also how to be more effective with that work effort. So technology has just been wonderful from our perspective, as driven by our transplant coordinators, nurse clinicians, what have you.
Yeah, I absolutely love that. So here, and by the way, Becky and Paul, I'm getting ready to ask you to pull the thread on a little bit of a burnout conversation that we're kind of segueing into here. But the takeaway from this breakout and this conversation, the takeaway for everybody on this call needs to be this: the stories or the narrative that consumes the airwaves consumes the culture. Right? And so the narrative or the stories that consumes the airways consumes the culture. So what story are you telling? The screen is scrolling with positive stories that have come out of the last 20 months. The question I have to ask is, are we telling these stories in such a way that people are able to lean in and go, you know what? Not all hope is lost. Look at all of the good that's come out. Because if we don't, human nature means we're going to slide toward what seems to be out of our control, and that it becomes that gateway for people to ultimately slip into this burnout. And so I'm curious, Becky, from an OPO standpoint, and then Paul, I want to get your perspective from a transplant standpoint here in a minute. What is it that you've been doing there at LifeGift to help mitigate some of the burnout that's just happening? And by the way, it's not just our industries. And this is all over. I mean, we're dealing with it in our industry. I get asked to speak on this topic probably 20, 40 times, 50 times this last year, because this is a big, gigantic topic. So Becky, what are you doing there at LifeGift to help mitigate some of the burnout that's happening?
Absolutely. And I love all of the comments. I can relate to so many of those. And yes, especially working virtually, the administrative staff, I think we hear Zoom fatigue, Teams fatigue, all of those sorts of things. But again, I just think the team member engagement, being aware. I had a team member this morning in a meeting that I think is going through some of that, and giving our teams a safe space to be able to discuss that, and being in tune with our team. I know that sounds very simplified, but I really think that, and myself as an HR professional, I really try to stay in tune with the pulse of the organization. We have quite a few resources for our team. And I can tell you our Strategic Governance Council is making that a priority for 2022, that we are making sure that our team is well taken care of and has the resources, because as this fatigue continues in this current environment, it looks like 2022 is looking positive. We will probably be moving to a hybrid environment, whereas our administrative staff has been pretty much virtual, with the clinicians, of course, being in the hospitals. But this is a priority for us in 2022.
Yeah.
So,
absolutely. Paul, what I mean, big transplant center, what are you doing to mitigate some of the burnout that's just happening all around us?
Yeah, I mean, I think it's important to kind of clarify what's burnout versus fatigue. I tell my staff sometimes, you may feel burnt out if you're going to use that term, but I'll tell you, if you're truly burnt out, it's a feeling of being stuck, right? It's like not knowing what the next day is going to look like, not knowing whether or not your boss is going to help you out, not knowing if you have an FTE to open up, not knowing what's going to happen, and always feeling like you're really stuck. That's burning out. From my standpoint, and we talk about this within our teams, like, how do you clarify, or how do you make sure that we're using the correct terms around what's fatigue? And I also actually break it down into what's pain versus hurt, right? I mean, we all talk about athletes, right? We're kind of like looking at the NFL season right now, who's injured versus who's just tired, right? And we need to be able to identify those people who are really getting to the point where they're going to break a bone, they're going to pull a muscle, and they're going to be out, or they're going to limp along, which actually then undermines the performance of the team. So we need to be very clear on what stage are we at, if it's just bearing through the pain or really being hurt and playing through the injury.
Paul,
So
this
for
is
me,
really insightful. This is huge. And I think a lot of times we lump them into just big bucket categories, but we're not thinking about it at that level just because we're moving so fast. This is really, really important conversation. So help me unpack that just a little bit here, because this is really fascinating. Fatigue versus burnout. You identify someone in fatigue. What's one tactical step that might help? It seems obvious, but I want everybody to hear it.
yeah, I mean, it would just be active recovery, right? It's not just stopping the work, it's active recovery.
Yep.
It's looking at it from the standpoint of how can I be better myself? How can I put on my own mask, if you will? And how do I take care of myself, knowing that if I do not perform, or maybe from a self-regulation standpoint, if I don't take care of myself, I can't take care of others. I can't take care of my team. I can't take care of my patients better. And knowing that if you aren't doing that yourself, that you are potentially compromising, your effectiveness. And really being clear about that, because we're healthcare professionals. We rarely look at the mirror sometimes and think, I can be better myself.
I hate to laugh, but my
Yeah.
gosh, what's the old saying? The cobbler's kids never have good shoes.
Right.
Okay, Paul, from your lips to God's ears, everybody needs to hear that, right? We're so focused on taking care of everybody else. Why is it that we don't stop to take care of ourselves? And I think many people are hardwired there. Look, I just wrote down something you said that I need to make sure everybody on this call pays close attention to, because you nailed something really, really important there. And that is active recovery. That is so important. And we just kind of fly over that sometimes. Our partners at Limeade in research says that there's 3 basic active recovery modes that if we think about, we can help coach, guide, or even to ourselves take care of that, right? There's detachment, right? Where I'm fully mentally letting go. Now, this can be tough at times. If we're working from home all the time, we don't have that boundary. If we're always at work at the time, we don't necessarily have that boundary. So there's detachment for active recovery. There's relaxation, which is something completely separate. It's low effort. It's a relaxing activity. And then finally, get this. This one seems almost counterintuitive, but the research bears it out. It's mastery. It's mastery, which means I lean into something I like and I become really good at that, whether it's biking or canoeing or hanging out with a team, but it's learning opportunities outside what I do. That helps our brains recover, because what it does is it switches off one part, switches on another part, and allows us to cover. So if everybody takes anything out, you got to hear what Paul's saying on this. Active recovery is massive. And then the other thing, you heard Becky talk about this also, and Paul talk about this. You've got to understand that burnout, you hear me on this, burnout is not a personal issue. Burnout is an organizational issue. We've got to be aware. Just like Paul said, you've got to be aware. Is it fatigue or is it burnout? You got to be dialed into our people. And when we're moving really fast, sometimes we don't always have that. Now, look, we're going to leverage the wisdom of this whole group here. So I'm going to put you in another very brief breakout. This will be your last breakout before we finish up. But we're going to leverage the whole group here, okay? I'm going to put you in another breakout, and we're going to ask you a question. What strategies or approaches have you implemented to reduce? Because we just talked about 2 here, but the power and the wisdom of this bigger group can probably bring in some additional encouragement that we can that we can gain from here. So we're going to put you in a 5-minute breakout. You know the drill. You get in there, you turn on your cameras, you have a good conversation, and then we're going to come back and you'll see that scroll up. We'll spend a few minutes with the panel. We're going to wrap up. We're going to, kind of do a rapid fire on a couple of additional questions, and then we'll wrap this up today. Thank you guys for hanging in there with me. So, Deanna, are you ready? We're going to send them into the ether world. 1, 2, 3, break. All right, here we come. We're coming back from the ether world of the deep reaches of the interweb. So if you've hung in there, with us to this point. I just want to say how much I thank you and appreciate each and every one of you. Once we get some of this popping up on the screen, we will go there. I was just having a conversation before everybody came back with the panel because compensation comes up over and over and over again. It was one of the areas that came up. And so when we look at how we're addressing burnout, I want everybody to look here. Psychological separation, flexible schedules. Somebody put in a chief wellness officer. Kudos, that's awesome. Staff rewards, fun activities, mental health, encouraging hobbies. Here's one that hasn't done much. So there's some low-hanging fruit for you. We're giving you some ideas, talking about culturally how you might be able to navigate some of that. Here's what everybody needs to understand about compensation and burnout, or compensation and labor shortages. If you haven't done it up to this point, I surveyed the entire panel, and the entire panel was unanimous on this. If you haven't done it recently, you need to check your market compensation framework, right? So you should be doing a compensation study to check your ranges to market, because they're moving. I'm based in Dallas, Texas, and the comp ranges are moving like the Dallas housing market right now. So you need, if you haven't updated your ranges in compensation, you need to make sure they're at market and that they're market competitive. That's where you're going to feel some of this pressure. So you can see right there, someone just said it right in the middle of the screen, additional market adjustments to salary. Yes. Now, I'm going to tell you what the research is telling us, and we've looked at the data on this. It's not the leading indicator to burnout. However, it's a leading indicator why somebody might move or why somebody might not stay. Becky, I see your hand up there. I love the fact that you're using your raised hand. What do you got?
Something I meant to mention earlier about Life Gift. We have an annual incentive plan, and we do that every year. We're going through that process right now. We have a consulting firm we work with, and we definitely adjust our ranges and compensation, and we're very competitive. And we're good to our employees with benefits, compensation, the whole 9 yards. Our annual incentive plan sets the organizational goals, and we have bonuses and incentives attached to our annual incentive plan. And so our entire team is working towards our organizational goals. And it's one of the most fabulous parts of working at Life Gift, because we're working as a team in every aspect. So for instance, human resources may not have a direct impact on organ procurement, but we do with regard to offering service and support to those teams that need it in every aspect. So everybody jumps in to help in every way.
I think that's an important aspect of understanding how it connects to culture. Remember, I told you earlier that there's 3 table stakes from a mindset, belief inside the culture that needs to happen in order for your culture to stay fully engaged. And that is meaningfulness. So everybody in the organization needs to know how they impact it. Availability, cognitively am I available, and then safety from a psychological safety standpoint. So I appreciate that. So just in the few minutes that we have left, I want to get into some of this technology, and I want the panel to share how they're planning the talent and the labor that they have, and what is it that they're doing to really squeeze all of the good juice out of the technology they have to help plan that. And look, everybody on this panel is doing a great job. I want to lean in with Ian first. Ian, in just a few minutes that we have left, can you talk to us on how you're leveraging some of your technology to help you navigate through how you're planning your workforce, how you're planning your talent, et cetera?
Absolutely. It's something we've done for a number of years now, but as I mentioned before, we've been able to tie it to actual work effort within our EHR as performed by all of our transplant staff. And we've just come to leverage the ability to put together dashboards specific to the transplant coordinator role, but not only the generic role, the pre-transplant coordinator, the post-transplant coordinator role, even the inpatient transplant coordinators that we have have dashboards on their work effort. The most important thing is that this is done in partnership with the transplant coordinators or nurse clinicians, etc. This is not done in isolation because they have to understand the data as much as management does or leadership does as well. And then the other key aspect here is how do you relate that work effort to future state in terms of growth? We grew 164 transplants year over year from 2018 to 2019. Obviously, that took a real effort in terms of right-sizing our transplant staff to manage that close to 600 transplants a year.
Wow.
And with that technology in place, you know, we would just be shooting in the dark, and that's not what we want to do.
Squeezing the technology. Diane, what are you doing there at Mid-America with your technology?
We're doing something similar and actually tracking worked hours, the intensity of cases, weighing and assigning value to a DCD case, Tony, versus a pediatric donor perhaps, and trying to really inform deployment based on what that data looks like. I think that's been a real key, and Ian, to your point, it's also helped us anticipate and facilitate growth and capacity needs as we go forward, because you realize there's a breaking point, right, for people, and you don't want to get them to that point. So using the information coming out of those systems has really been powerful.
That's huge. Sam, what would you add? How have you been squeezing your technology?
Well, so I'll be honest, this is something that we have not mastered yet. I think, again, one of the I guess, non-great things about being a smaller program is we don't always get all the resources we would love to have being such a small program. But one thing I will say that I appreciate, being the leader of a transplant program is we partner really closely with our OPO, and our primary OPO is Gift of Hope here in Illinois, and they actually give us a wealth of data. So when we're looking at organ offers, how we're handling those, and we're using that data to help, dictate, do we need additional staff? Do we need additional hours? All of that kind of stuff. We rely a lot on our partnerships with our OPOs to get some of that information, because we unfortunately have just not yet mastered that. And I think probably a lot of transplant programs are probably in a similar situation. So also think about not just what you have access to, but think about your partners, your transplant programs, in the areas that maybe you don't compete with, but you can partner with, your OPOs. Where can you get some of that data to support your workforce, your needs, and your growth?
So I can't tell you how much I appreciate you saying that partnering with your OPOs can be very, very helpful. And look, I don't know if I buried the lead on this, but as a board member on an OPO, which is one of my other job responsibilities, I can tell you that in our OPO at Southwest Transplant, that is exactly the mission, squeezing the technology and actually leading the way on much of the technology to help the transplant centers where we can come along and support. So I think the message that we want to come out of this with is this, together we can utilize all the technology that we can to help each other along the way, because we are all in this together at the end of the day. It's not us against them. It is, how do we all tackle this big, gigantic mission? We have 1 minute left, and I just want to share some final words of encouragement with everybody. One, I want to thank the panel. My gosh, you all are amazing. I just want to hang out with you and go have a coffee or a drink or a sweet tea or something afterwards and just hang out. And I promise in the next year or two, I'm going to come and high five each and every one of you live. So I thank you for your wisdom, for your insight on each and every one of this. Look, this is the final thought, and then we're just going to close this out. When I was writing my book, The Kingmaker, I researched all the kings I could find when writing this book, and I came across a 3,000-year-old proverb from a king that I think fits us well. And it says this: two are better than one, because there is a good return for that investment. Should one fall, the other is there to pick them up. But pity the one who falls and has no one there to pick them up. I want you to walk away from this webinar knowing that all of us are in this together. And should one of us stumble, the other is there to help pick us up, whether it's internal or whether it's external, that this network of life-saving individuals is changing the world one person at a time. And I couldn't be more proud to be part of it. So thank each and every one of you for all your wisdom and for being part of this amazing journey. Until next time, make it a great day. We'll see you.
Thanks, everyone.